Did you know that India is the most depressed country in the world? Around 5 crore people in India suffer from depression. Globally, India has the highest suicide rates for young people. Depression has never been the same since Deepika Padukone. To learn that someone so rich, so famous, so beautiful was suffering from depression actually made the rest of us mere mortals feel slightly less depressed about our own lives. It's about time you save yourself from depression. The question is how? Did you say antidepressants? Believe me, antidepressants do more harm than good. It is absolutely the biggest lie ever told that antidepressants are your rescue partners for depression. A recent study reported in the National Center of Biotechnology Information showed that the long-term use of antidepressants causes adverse effects such as sexual dysfunction, weight gain, and sleep disturbances. Clearly, a case of the cure being worse than the disease. Antidepressants can also be addictive and cause withdrawal symptoms like insomnia, headaches, and tiredness. One of the biggest challenges that I have faced in treating patients of depression is that they do not want to be treated. They are often forced into medical consultation by family members. Patient compliance is another issue, which means that they don't regularly take the medicines that are prescribed to them. So what would I suggest? Well, the first thing to do is to acknowledge that depression is an actual medical condition. While some cases of depression are internal, most cases result from external circumstances. Given its intuitive, holistic, mind-body approach, homeopathy is the ideal choice of treatment. It offers safe, natural, and customized plans for patients of depression without any side effects. It does not merely look at the symptoms, because no two patients of depression present with the same set of symptoms. While one patient may feel sad and withdrawn, another may develop suicidal thoughts. Instead, homeopathy goes to the root of the problem. While it cannot change the circumstances causing the condition, what it can and does do is to help alter reactions to that circumstance. If depression occurs from a recent disappointment in love, the medicine Ignatia may be used. However, if depression results from long-lasting grief, Natramio is suggested. Similarly, if depression results from procrastination, Staphysagria is often used. I remember one case of a patient who suffered from postpartum depression. She became indifferent towards her loved ones, including even her children, lost all interest in intimacy with her husband and in routine daily activities. We gave her the homeopathic remedy sepia. Within just a couple of months, there was a remarkable change in her behavior, and soon she was back to normal. Along with homeopathy, here are some simple steps I recommend. Step 1. Acceptance. Did you know that around 50% cases of depression go undiagnosed? Stay alert for these signs: sudden withdrawal from family and friends, persistent feelings of sadness, guilt, and hopelessness, having trouble sleeping, and harboring suicidal thoughts. Immediately seek medical help if you see any of these symptoms. Step 2. Do not self-medicate, as it can cause severe adverse reactions and dangerous drug interactions. Step 3. Check vitamin D levels. Deficiency of vitamin D in elderly people is associated with an increased risk of depression, resulting in early death. Step 4. Exercise. It releases happy hormones called endorphins that help you feel better. Step 5. Sleep well. Melatonin, a hormone that makes you sleepy, is released in the dark. So turn off the lights, avoid keeping the television on, and use blackout curtains or an eye mask to block out the light to get better sleep. And you will come out of that black pool of depression. Just like Deepika, who emerged to find love and happiness, so can you. Till we meet again, stay healthy, stay happy.